Alrighty, Washington team. It is 5:30. We have 10 people in the waiting room. Are we all good to admit them and
Yeah,
go?
yes.
Thanks, Dr. Kim. Great. Okay, I'm going to admit them all. It takes a minute for them all to get in, but here we go.
Thank you.
Excellent. Hi, everybody. Welcome to today's AHEC Scholars Seminar. This is our March seminar series, and I'm so excited to have so many folks on the call. Today, we're joined by an awesome team from the University of Washington School of Dentistry. So I'm going to turn it over to our Washington team for introductions and to get our program started tonight. So thank you all for being here.
Thank you, Danica, and thanks for inviting us. We always enjoy these learning opportunities. So I'm Amy Kim. I'm the Assistant Dean of Community and Dental Education Programs at the University of Washington, and I brought my best and brightest dental students with me today. Chris and Jonathan, Priyanka, I'm going to let y'all introduce yourselves. Chris, you want to go first?
Yeah, hi guys. I'm Chris. I'm a second year dental student here at the UW. I'm around from this area and been a part of this program for a little bit and excited to be here and excited that you all are taking the time out of your days to come and learn a little bit with us.
And
Jonathan?
then, hey everybody, my name's Jonathan. I'm a D3, so third year dental student here, and I'm from the Seattle area. But yeah, excited to teach y'all a little bit about oral health tonight.
Priyanka?
Hi everyone, I'm Priyanka. I'm a final year, so D4 student at the School of Dentistry with the University of Washington, and I'm excited to be here with all of you tonight. Thanks for joining.
And last not but least, we do have another student with us. She's not a dental student, but she will be soon. Noelle.
Hi everyone, I'm a pre-dental student. My name is Noelle. I work as program coordinator in the Office of Educational Partnerships here at UW.
All right. So we're going to talk about oral health today. And some of you might be thinking, I'm not in dental school. I don't care about the mouth. I hope that's not what you're thinking. But if that is what you're thinking, we're here to disabuse you of that notion and remind you that the mouth is connected to the rest of the body. So the objectives for today are that we're going to map the complex and interwoven causes of a major public health problem, which is caries, and today specifically it's pediatric caries. We're going to identify interprofessional partnerships to improve oral health at the individual and community level. That's why you're all here, because we want to work with other professions to address this large need. And then lastly, we're going to broadly define the team of health professionals outside of dentistry, because like I said, we really need to partner with folks outside of dentistry because it's a very, very large, complex epidemic. Pediatric caries is an epidemic, and I say that because it's contagious. But the interesting thing is that it is preventable. It is 100% preventable. So it's actually quite frustrating for those of us in oral health care to think, there's so much suffering and pain and disease that happens. But with some help, educating, preventing, we can eradicate caries. And then the mouth is connected to the rest of the body. And, I kind of say that jokingly, but not jokingly, because the oral cavity it's an area that can really harbor a lot of microbes, and it's a direct entry for microbes. And I think people kind of forget about that. It can also affect other systems like the cardiovascular system and the lungs. Oral health can also serve as a good first place to assess overall motivation for self-care. That's not always evident for children because children are children, they need help. And so it's also a good time for you, or a good opportunity for you to see how they're being cared for in their families. So our dental students are going to go over some basics about oral health, dentistry, caries, and so you'll learn a little more about that today. And then hopefully you'll understand some of the health implications, and that it's a very multifactorial, complex issue, and that we all need to work together. So, uh-oh, what happened? Make it stop.
Abby, let me try muting you.
What did I do?
I think we're good now. You're muted, Dr. Kim.
Chris and Jonathan, you can go ahead with the peer teaching.
Okay, should we have people take the pre-survey first?
Yes, thank you so much for reminding me. This is why I have my students here. So it's really important for us to know that we are helping to move the needle, and we'd love for you all to take just a couple minutes to do the pre-survey, and then at the end, we'll do a post-survey as well. This work is being funded by research grants, and so, of course, it's an important part of quality assurance for ourselves, but we also want to know that we are being effective teachers for our grant funders as well. So AHEC scholars, if you would, please take just 2 minutes and take the pre-survey, and then we can get started.
Yes, so I'll give you all like a minute or two to fill this out, and then we'll get started with the presentation.
We had a question in the chat. Hannah asked, where do we access the pre-survey? Hannah, if you use your phone, it's on the shared Zoom screen and you can use it. You can use your phone to scan the QR code. I'm also wondering if the University of Washington team could maybe put the link in the chat for some folks who may not have their phone.
I'm working on putting that in the chat just so you know.
Thank you.
It should be in the chat now,
Yeah.
probably.
I'll give like 20 more seconds because I know Hannah just started it, so.
We've also had another team member join. Jonathan, if you wouldn't mind introducing Madeline as part of your presentation, please.
Yes, yeah. So we have Madeline here. Do you want to introduce yourself, Madeline, or where is she? Is she here?
I'm here. Yes. Hello everyone. It's nice to be here and thanks, Amy. My name is Madeline Kaplow and I'm from a foundation in Washington State, the Arcora Foundation. We're funded by Delta Dental. And my day and night job is training medical professionals, a lot of the time, those who are already out in the field of practice to remember, as Dr. Kim mentioned, that the mouth is part of the body. So bringing oral health to the healthcare that they're providing, especially to young children. And it's really nice to be here, and it's fun to see you all here to learn this great material that these amazing students are going to share with you now.
Okay, thank you, Madeline. So without further ado, we'll go ahead and get started with the presentation. So the first slide here is just a simple overview of the caries process and how caries, or what we call cavities, form. So it all starts with food. and specifically foods that are high in carbohydrates and sugars, because you have a lot of bacteria in your mouth and you have a lot of bacteria on your teeth, and those bacteria feed on the food and they feed on the carbohydrates and they metabolize them. And one of the byproducts of that is acid. And so the bacteria by themselves aren't bad, but when they metabolize the sugar and they produce the byproduct of acid, that's really bad for your teeth. And so the longer that those bacteria are on your teeth producing those acids, the greater the chance that you will kind of erode that enamel and kind of start to erode holes into your teeth, and that allows bacteria to penetrate further. And that's what we call a cavity. This is really important because if the cavity gets deep enough into your tooth, you have every single tooth has what we call a pulp in the center. It's like a hollow part where the nerve and the central blood supply is, and that's where it can become systemic. So it's really important to really address cavities early. And also patients can experience pain with cavities. So it really is just important to address them early and to limit them. And some of the ways we can limit them is with diet. So, sugars that are or foods that are high in sugar, limiting that so that the bacteria don't have something to feed on. And then also, looking at someone's salivary flow is actually really important because a person's saliva can actually like dilute that acidic environment and kind of buffer it. And so that limits the amount of acid and limits the amount of damage that that acid can do. And so dental caries, we talked about why is all this important? Well, dental caries is extremely common. This is some data from low-income children in the state of Washington, and it's a little bit outdated, but as we're seeing, caries is only the prevalence is only increasing, and especially in rural areas, we see that the prevalence is super high. So like by third grade, we see that over 68% of people have had a cavity. And so this really is a common issue and you will run into it. And so it's important that you all are educated about it because oftentimes you're some of the first people that these patients will go to before they even go to a dentist. And that's why we try to educate medical providers is because children will actually see you before they see a dentist. And so if you can educate, if you can identify these things before they progress to more severe infections, that's amazing. So yeah, children will see you at their well child visits, at infancy, at annual visits throughout childhood. And data shows that, yeah, they children will see medical providers before they see their dental providers. And so it's really important that you can provide OHI, which is oral health instruction. So we're going to kind of teach you just the basics of oral health instruction because the more we can reinforce that, the more impact we can all have. Um, Also, we talked about how sugar is really detrimental because the bacteria feeds on that. It leads directly to cavities. So if we can counsel patients on their nutrition, that's another thing that we can do to prevent this epidemic of childhood caries. And then talking about fluoride, and even I think in some states, medical providers can actually apply fluoride too, and it's a very protective measure. And we'll go into how fluoride is protective against cavities as well. Yeah, so oral health instruction. I think you all know that the standard is brushing twice per day. We like to tell people to brush in the morning when they wake up and, at night before they go to bed. And if they can, flossing once a day. I know that's difficult for children. So, the more you can try to educate them, the better. And then also using fluoride toothpaste because fluoride gets incorporated directly into your enamel and it actually makes it more resistant to acid. So fluoride is actually very protective against the acid that bacteria produces. And then you can see here some of the technique of proper brushing. So it's called the modified Bass technique. That's kind of in the weeds, but showing them the 45-degree angle towards the gums because we see at that gum where the tooth meets the gum, that's where we see a lot of buildup. So really showing them 45 degrees towards the gums. If you that like this is actually the more we can reinforce good habits, the better. I know you might think like, well, we're nurses or we're medical providers, like we don't this is out of our realm, but it's just something simple that you can do. And then you can also just, reinforce the fact that patients should go to their cleanings, should go see their dentist. So, maybe sending out the referral or just reminding them that, they should go see their dentist can go a long way as well. And then nutritional counseling. So, I think we all know what healthy foods are and what unhealthy foods are, like whole foods, whole grains, fresh fruits, drinking water instead of soda, limiting snacking, especially on sticky foods and sugary foods is really important. Sticky foods will stay on the teeth longer, and that in itself will, have let the bacteria feed on them longer, produce more acid. Trying to limit sugary drinks because drinks like sodas are sugary and they are acidic. So they have both. Same with orange juice. Not only do they have the sugars that the bacteria can feed on, they in themselves are acidic, so they will just erode the teeth. So, counseling patients on healthy foods and foods that are good for their body and their oral health can go a long way as well. And then um, sometimes you can't change what people eat. So sometimes they will snack or they will eat sugary foods. They will eat acidic foods. One thing you can tell them is to rinse their mouth out after eating something super sugary or super acidic to kind of get that out of the mouth. And then, brushing, we like to say 45 minutes after they eat, something like that, something sugary, something acidic. That can really help protect their teeth too. So that's just something you can tell patients. And then we mentioned fluoride varnish as something that you all as healthcare providers can do. I'm not sure about what the laws are in Montana. I know that there's some healthcare providers that are getting trained and are allowed and are actually getting reimbursed to apply fluoride varnish. So that might be, if it's not already in Montana, that might be something that's coming your way. But it's really important because,
Jonathan, I don't want
yep,
to interrupt, but in Montana, they can. Primary care folks can apply fluoride varnish and they get reimbursed.
okay, awesome.
It's a
Yeah.
good thing.
So that's great. And the way that it works, I mean, it's a topical varnish, so you just brush it on the teeth. It takes 30 seconds to a minute, and it gets incorporated into your enamel, and it strengthens the enamel, and it makes it so that acids will actually demineralize that enamel less. So it's very protective, and it's like one of the most studied things in dentistry. And so, we always say that's one of the best things people can do is use fluoride toothpaste, and every 6 months get topical fluoride varnish as well.
All right, I'm going to take over from here. So another treatment option we have, and I also believe that medical providers in Montana can provide this also, is silver fluoride treatment. A lot of what Jonathan had talked about are more so like preventative measures to prevent even like the onset of caries or like early caries when you get them, how to stop that from becoming something disastrous and progressive. SDF is a little bit different in the sense that you only apply silver fluoride to active caries or caries that have already progressed a little bit into your tooth structure. This um, SDF treatment works by being an antimicrobial agent. So essentially, it stops all the tooth decay in its tracks in your mouth. And it also helps the tooth sensitivity that might come from your caries disease. It's used to essentially arrest caries. So when your caries are progressing down and getting closer and closer to that pulp and that central blood supply, you can apply SDF to that localized area of decay, and it essentially stops it from worsening and stops it from becoming more of a systemic issue. It can also be used as prevention, but not so much prevention in the way that a fluoride varnish or oral health education or nutrition is, but rather prevention from an ongoing and worsening dental decay. And essentially, if a patient is like unable to get treatment for some variety of reason, maybe they're apprehensive or have a medical issue that's preventing them from having treatment at this point in time, silver-diamine fluoride can be used to stop that decay until they're able to get a final restorative treatment later on. It works by kind of a dual purpose, and it's kind of in the name, silver and fluoride. Fluoride works by remineralizing the tooth, like the fluoride varnish, and then the silver is actually toxic to the bacteria. And all the bacteria that are in your decay in your tooth, when it gets hit with these silver ions, they actually can die. And then these bacteria are no longer present and they can no longer feed on these food and produce this acid, and it stops the caries process. You can go to the next slide, Jonathan. Does anyone have access to the next slide?
I just changed it. Can you see?
Yeah, cool. So there's a lot of benefits of SDF. One is that it's super easy to apply. It's very quick and non-invasive. It's not like you're drilling a hole in any tooth. It's also really patient friendly, in that patients that can't tolerate these long and complex procedures, they can get SDF treatment in a non-invasive and non-complex way. And it's very, very cost effective. It's a low cost option. It's great in rural environments and areas that don't necessarily have access to treatment like more urban areas might. There are, however, some adverse effects of SDF, and the main one is aesthetic concerns. When SDF is applied to your tooth, any area that is decayed and has all that bacteria present in it will actually stain entirely black, like you can see in this picture over here on the right. And that obviously is not optimal for adult patients. So if you have caries in like the very front of your teeth and you don't want your teeth to be all black, but it's great in pediatric patients where they might lose their teeth in a couple years, or in the back of your mouth, like your posterior teeth that you can't really see. It doesn't matter if it's stained black, or sometimes in elderly patients also. It can also, if it contacts the gums, it can temporarily stain your skin or gums. And it does require reapplication. It's not a permanent solution. So typically the rule of thumb is to reapply this every 6 months, at least once every year. You can go to the next. How do you apply SDF? And because I believe you guys maybe it'll apply this in Montana. It's a really simple process. It's just 4 steps. You dry the tooth with like a gauze or a 2x2. You just kind of rub it on there, maybe put some air to make it a really dry working environment. And then you just place the SDF right on the visible caries and the cavities that's decayed or maybe a little darker, sticky areas. You want to make sure you don't spread this to the gums or to the gingiva because, as we talked about, it can have a temporary stain on it. You then allow that just to dry for about a minute, and then any excess around the area of decay, you want to remove it. Sometimes you can apply like a fluoride varnish over the top to help seal it in, but it's, other than that, a very simple process. And then like we talked about, you do that once every 6 months, maybe once every year. So why is this important? And essentially, SDF is really helpful in stopping the progression of dental caries because dental caries can progress fast. Essentially the 3 main stages of it. On the left, you can have early caries, which show up and are sometimes hard to see, but they're like a white chalky substance on your tooth. They haven't broken down any tooth structure yet, but it's the early process of dental caries. So the bacteria are present and are producing acid and are starting to slightly demineralize your enamel. And at this stage, it is entirely reversible. You can apply fluoride and calcium and phosphate in your saliva can help to remineralize your tooth. However, this can quickly progress to a moderate carie where you start getting erosion of that enamel, which is the outer surface of your tooth. And this can rapidly progress. And this is where SDF treatment is typically applied in this moderate stage. This moderate stage can then progress to a severe stage where if those cavities keep going deeper and deeper in your tooth and then hit your pulp, it can go through your pulp, up through the bottom of your pulp called your apical foramen, and then up into your periodontal tissue or your gums, and it can create an abscess. A lot of times this abscess is only visible on an x-ray, but it can also sometimes be visible just by lifting up the lip and looking and seeing if you see any abnormal bump or swelling or like this picture on the top right. Also by lifting the lip, you can sometimes see areas of decay on the front of the teeth or usually closer to the interproximal areas, which is like between your teeth. And as medical providers and when we're looking at how we can integrate oral and systemic health, it's important to add this as a part of just normal checkups because this tooth decay, if it's seen early, it can be treated very easily and reversed. Whereas if it's seen much later, it can lead to severe systemic issues. No matter what stage of cavities you see, it's always important to explain oral hygiene to your patients, nutrition to your patients, and fluoride varnish, like Jonathan talked about. And then always refer to the dentist if you're not exactly sure how to handle it. One of the main reasons this is huge is because these abscesses and severe diseases, if they don't get seen early, can become systemic. They can travel through the bloodstream, through the venous system. They can go through your fascial and down into your neck. It might cause like airway restriction, or it can go to your heart or your lungs, and it can even go to your brain. There's a lot of different avenues that these bacteria can travel throughout your body that directly causes systemic issues from an oral disease. One tragic incident of this is with a kid named Demonte Driver. He was a boy from Maryland, and he was only 12 years old, and he had a tooth infection, and he actually had an abscess in his tooth. He did not receive adequate treatment for this abscess. He left his provider, and then later that abscess actually traveled up through his gums and went to his brain, and he got a brain infection. And he was seen in the hospital, had 6 weeks of operations, and actually passed away. And what is so sad about this story is it was caused by a simple dental infection that could have been treated early on when it was just a cavity. It could have been treated at the infection stage when it was an abscess, by taking out the tooth, which is a very simple procedure. It's less than $100 and it completely resolves the issue. But since it was not treated early, it progressed to a systemic issue and took life for this boy. And beyond just systemic issues, dental decay is costly. It's costly in the form of monetary values. It's very expensive. I mean, once your dental decay progresses to a point that it's needing severe treatment in the operating room, it's costing thousands of dollars to these patients and these families. It's also detrimental to a child's life, and that they can't eat the same. They can't play. It's always dental pain is painful and it affects their ability to sleep, to learn, their self-confidence if they have a bunch of pain and like discolored teeth. It also causes them to miss a lot more school. Kids are three more times more likely to miss school with dental disease, and there's over 50 million hours of school lost yearly dental disease. And a lot of this can be treated if we treat it early and if we see the signs and the symptoms of it, and then help to just teach people to, brush their teeth commonly. If they have cavities in that, you make sure you see a dentist. Make sure you do all these preventative measures to stop it from worsening and stop that pain from progressing. Like this. Priyanka, did you want to introduce the case, or did we want to do the post survey before the case?
I think we should do the case and breakout rooms, and then we'll do the post survey after. What do y'all think?
I think that's perfect.
Yeah.
Priyanka,
Okay, everyone. So, yeah,
do you want me to stop sharing and then you share?
sure. Yeah. Jonathan, do you want to share your screen? It'll be easier if you share your screen.
Sure. Let me just pull
Yeah.
the case up real quick.
Thank you. Yeah.
And this is a great opportunity too for our AHEC scholars to pull out that printed version or the document that I sent yesterday to you.
Thank you, Jonathan. All right, so I'm hoping you all got a chance to take a look at the case, and hopefully we can discuss a little bit more and come up with great ideas of how we can help our patients in our community. So the case study we're bringing today is from the Seattle Children's Hospital Emergency Department. So it was a 4-year-old girl who came to the ER room with her mom because she had pain and swelling in her jaw, which had spread to a cellulitis. So the history for this case was, I'm just going to go over the case a little bit and then we'll discuss more. So this 4-year-old girl had a recent dental visit, overall doing very healthy, normal pregnancy, no complications, and she had pain, but that day when she went to the dental treatment, she wasn't cooperative. She was a little shy and, was not ready to get x-rays done. And then her mom, they came back home, and then within a week, it had spread to a cellulitis where the kid had a swelling, and they took her to the pediatric hospital because of fever, swelling, and this was all. And then she had taken a dose of Motrin at 3 a.m. So if you go through the case, I'm just skimming through the details. So there was a left facial region noticeable swelling with erythema on the cheeks and around her eyes. So the whole face was swollen. It was tender to palpation. And just imagine it's like a 4-year-old girl and she's going through so much. And you know what? And then they were able to take some x-rays and they were attempt to find like what was going on was related to her dental history. So, and how quickly the whole condition had spread within a week's time and how she ended up in the ER. And this case is very similar to what Chris was talking about, DeMonte Driver, right? Where it had spread to the brain and abscess and had multiple surgeries. So with this case, we saw that there were abscesses in the tooth, which is basically an infection, like we were talking, that started in the tooth and went to the gums and was trying to spread into the spatial spaces around her cheeks. And that is the reason of the swelling. So, does anybody have any questions about the case, or have you all encountered anything similar in your practice in the past and would like to share with us?
We are going to make you share with us in a small room, so this is good rehearsal.
Yes. All right, let's look at what the treatment was, okay? And then I think we'll discuss more when we go into our breakout rooms too. So they did, so the initial treatment was IV antibiotics and then initiation of clindamycin and ibuprofen for pain management. And then the attending dentist was consulted and repeated the exam and, you know, considered general anesthesia, imaging, and getting treatment for that patient. So I think what we want to discuss now in our group discussions in the breakout rooms is, you know, the patient was treated at the dental surgery center with general anesthesia and there were extractions that were completed. But what role do you have in this patient's care when you encounter a patient like this? And then what is the role uh, uh, your role with the discharge and transition of back into the community, making sure that they're being seen? Whom do you communicate with? Do you have a dental team that you would refer these patients to? And then what is your role in diagnosing, treating, and preventing, and then also referring similar cases in the future, which is very much related to what we're talking about today, is trying to prevent rather than having this patient come to this situation when they come to the ER, or the DeMonte Driver's case where, you know, they need multiple surgeries due to complications and other systemic involvements. Any questions?
Priyanka, do you want to go over the ecological model as well? That was in our
Sure,
packet. Yep.
sure, yeah. Jonathan, if we scroll down, yeah.
Oh, was it on the same?
Yes, yeah,
It should be at the bottom, at the
yeah.
third page of the handouts. There you go.
Yep. So,
See it.
yeah, can we zoom?
Let me see if I can try to flip this to
Sure.
the side.
Yeah.
Oh, wait.
I think this is a good spot. Yeah.
Okay, I'll zoom out here.
So I think keeping this model in mind and something around our discussions when we answer these questions in the small breakout rooms too, is like if we reflect on the individual factors, right? So because this patient maybe wasn't cooperative, maybe their parents were busy, their complaints, like what led the situation to aggravate to this point, keeping all those factors in the mind when we see a patient coming in with a dental emergency, or seeing a patient where when we see them for the first time, like we're emphasizing that as a medical provider, you're seeing patients more frequently. So maybe considering individual factors, their diet, their oral hygiene, talking about oral hygiene. I think all those factors come in uh, at this stage. Then thinking about the interprofessional factors, just like I said, if how are certain medical conditions related to, of course, with pediatric patients, maybe diet and any other conditions if patients are suffering from leukemia, you know, their oral hygiene, maybe their gums show early signs of swelling. Those kind of factors where our collaboration together plays a role. Also in terms of community and social interactions. So depending on where they live, how far away are they? Are they in a rural area? Do they have access to care? What kind of community, what kind of food they're getting through school lunch programs, all those kind of factors come in as well. And then also public policy, like we talked about fluoride. If there is an opportunity for you to give fluoride applications and SDF in your practice, and knowing that these patients might not have access to a dentist, I think being aware of these and implementing these in daily practices and trying to find a dental home for every pediatric patient that you see. So we say that whenever a kid is 1 year or when their first tooth erupts, whichever is sooner, it's good that they have a dental home and they see a dentist. So every time, maybe as providers for, dental, medical, and all of us interprofessionally, if we think about, uh, does this patient have those access to care in terms of where their oral health comes in, and where with all the different factors that play from the individual to environment to community and also policy, and taking those into consideration and guiding our patients in the direction would help us prevent oral diseases and caries at an early stage rather than having it spread to, some of these complications that we're discussing today. Is there anything that you would like to add, Dr. Kim?
No, I think you did a great job. Just encourage everyone to really engage and participate in this discussion. And I think we're ready to get into small groups now.
Okay, I'm gonna go ahead and open up the breakout rooms. So we'll spend about 15 minutes within the breakout rooms. I'll go ahead and give like a warning. And then we will come back and talk about discuss as a larger group. Sound good? Okay. Let me know if you are not assigned a room, and I can throw you into one of them. Okay, there we go.
Nice job. All the tech is working.
Yep. Yeah, I did notice when we started talking about breakout rooms, I noticed that there was a little drop in the participant list
Oh, was there
because I
really?
had to switch around some of the groups to make sure that they were kind of even. So, like,
Um,
oh no.
well, they don't get full credit if they don't attend, so
Yeah, so I'm sure you have like the attendance reports and such, but I just noticed
yeah, I
that.
will get
I
that.
was like, oh no.
Oh, funny, funny, funny.
Hmm.
Well, this is great. I'm catching up on grading.
Oh, good. Okay, I'm gonna
Oh,
go ahead and set a timer for myself so then that way I know when to.
great.
Okay, I'll
I
go
hope
ahead.
that people turn their cameras on and engage.
I know. I'm sure that Dr. Kim will tell them to turn them on at the pick.
I
Yeah,
bet
and I saw
so.
your message too.
Good. Okay, I'm glad you did.
Hmm. Okay, let's see. I'll put a timer for like, I'll do 12 minutes. Okay, I'm gonna go ahead and mute and then turn my camera off, but I'm still here if you need anything.
Great. I'll just be here. Thanks, Renee.
It looks like there's someone in the waiting room.
I just saw that too. I just admitted her. Hi, Ellie.
Muted. Hi, sorry. I literally could not get my computer to work and I had to log out and then log back in. I'm so sorry.
That is okay. Do you remember which breakout room you were in?
Too. And I felt
Two.
bad. I was
Okay.
trying to get it to work and Kim was like, "You need to turn your camera on." And I was like, "I'm trying."
Okay,
Well, we'll
you were
put
in
you
room
back in
two.
breakout room two.
Perfect. Thank you.
Okay, give me one moment. Okay, you should have an invite. Okay. Yeah, I see her in there twice now. So,
It's, I mean, every time that I download the attendance for these, it's like some people be like there for like they'll have like it's like total attendance time. And it's like 2 minutes, 1 minute, 1 minute, 2 minutes, 1 minute, 2 minutes, 68
yeah,
minutes. I'm like, oh, they had some technical issues.
yeah.
Yeah.
I'll tell Amy and be like, gotta give her slack now. She was trying. Okay, I'm gonna go ahead and close the rooms since I know we only have like 8 minutes left. So, okay.
I was
Oh,
muted. Sounds great.
okay. Okay. They should be coming back here soon. And I'll share out here too.
We're back, Danica.
Welcome back.
Yeah, so we had a great conversation. Jonathan did a very nice job facilitating room two. I hope everyone else did as well. We were just gonna have folks debrief, share any nuggets that they learned and will be taking away from the session today and complete the survey. So Renee, if you wouldn't mind putting the survey back up. And for the first 3 people that give us some very good nuggets to take home, you're going to get a special prize if you put your address in chat and give us a good nugget. And Danica, you can't because that you're cheating.
Deal.
I feel like the information about when it's like progressing, like the carries you were talking about, that was really good information to know, especially as a nurse and like assessing patients. Um, just knowing what stages they're kind of in and how close it is to the pupil of the tooth, I guess.
Awesome. Thank you, Mackenzie. Don't forget to put your info in chat so we can send you a present from UW.
I am taking something good away from that Chris said. Um, just with like having a soda with dinner, and just like drinking it and being done with it is actually better, not good for your teeth, but better than like sipping it for a long period of time, which makes a lot of sense, but I just hadn't thought of it before.
Good job, Chris.
And to add on to that, with your little kiddos, thinking about the extended use of sippy cups and bottles with sugary, that's just the perfect like titration, slow. But so getting kids, another reason to get kids off of those things as quickly as possible to a glass.
I was really interested in the discussion about silver diamine fluoride. I had never even heard of that, so I thought it was really encouraging to, if patients are in a place where they can't have a cavity filled or they have a health condition and they need to wait, they can actually prevent the worsening of the cavity if they get the silver fluoride. And that's super non-invasive. And I thought that was just good to know about as a nurse. I can suggest that to future patients.
Yeah, and in Montana, you can, as a nurse, apply fluoride or silver diamine fluoride and get reimbursed, which is so nice. And again, that takes us back to the ecological model where that goes all the way up to public policy. So Montana's doing something right there. All right. Anyone else want to share their learnings? Well, please go ahead and put your information in chat so we can send you a little treat from UW, sugar-free. And please complete the post survey and then we can wrap it up.
Amy, I just wanted to give one little plug there. If some of you are as captivated as many of us are by oral health, there is a great online resource called Smiles for Life, and they have a lot of modules that you might find of interest. There's a new one on silver diamine fluoride, and there's some medical provider training. So feel free to geek out on Smiles for Life to get some more and readily available information.
And to add to that, thank you so much. That's a great plug. The Smiles for Life trainings are on the Montana AHEC Canvas page for scholars. And if you complete those trainings, you can use that time as part of your educational hours, as well as if you complete 6 of the 8 modules, you're also eligible for a $250 stipend. So we recommend that you complete those trainings. They're very interesting, very educational, and a lot more great additions to what you've already learned today.
All right. Well, thank you for having us, Danica.
Yes, we have 2 minutes. Are there any questions for Dr. Kim or the other folks from the University of Washington?
I have a question. What are we supposed to put in the chat? You said our
Oh,
information.
if you were the 3 superstars that had the nuggets that they shared with us, UW wanted to send them a present.
Oh, okay. I was a
So,
little confused about
yeah, if they wanted to put their address in there, or
that.
you can provide it to Danica too.
I can connect it to the team.
All right. Thanks, everybody. Have a good night.
Thanks, Dr. Kim. Thanks all.
Thank you.
Thank you.
Thank you.
Thank you.
Thank
Bye,
you.
everyone.